Hi, I am Dr. Sridhar Kalyanasundram. Welcome to my channel. In this quick video, I'll be discussing about two types of swelling on the baby's head, cephalhematoma and subgaleal bleed. So, just to go through the layers of the scalp for you to understand better. So, we have the scalp, and this is the brain inside, and we have the dura mater, which is the lining of the brain. We have the skull bone, and the lining of the skull bone is called the periosteum. And we have the muscle layer of the scalp and the galeal aponeurosis. So we have risk of bleeding in different parts of these layers. So you may have subdural bleed when the bleed happened just over the surface of the brain. This is quite serious. We may have a bleeding in the periosteum, so this is called a cephalhematoma. Because it is limited by the suture, it doesn't cross the edge of the bone. So suppose we say it's on the side over the parietal bone, it doesn't cross the parietal bone surface. So this is how we can distinguish, and it's a fairly tense swelling because it's limited by a tight periosteal lining. A more serious type of bleed is a subgaleal bleed. We'll discuss that as well. And caput, as we discussed earlier, is just a fluid accumulation in the subcutaneous tissue. This is the most common and the mildest of all. A cephalhematoma collects between the baby's scalp and the skull. The blood is beneath the periosteal lining, so it's between the bone and the periosteum, which is the lining for the bone. So it's limited by the edge of the bone by the suture, and it's often due to the suction effect of the birth tract on the fetal head. It can happen in rapid deliveries or instrumental deliveries, but it can also happen in otherwise normal deliveries. So you don't need trauma to be associated with the cephalhematoma. Even a normal delivery, you may find it. Typically, the blood accumulates over the first 24 hours, so you may not see it on the first day after birth. And then when you come for the postnatal check the following day, the swelling becomes obvious. It can expand over 2 to 3 days even. Fractures are not common, so unless you have a definite difficult delivery, definite signs of fracture, more bruising and other factors, you may not need to do any imaging studies. There is a slight increase in the risk of jaundice due to the blood breaking down, and this is how the cephalhematoma looks like normally. And when you squeeze on it, fluctuation is positive. That means if you press on one side, it conducts to the other side, and it also has a ping pong like feeling. It resolves over a few weeks, and it doesn't cause any serious blood loss in the baby. We can reassure the family that it will harden, the center stays soft. We need to be careful not to massage the head vigorously. In some cultures, there are people employed to do massage of the baby. They may do a vigorous massage, and that can sometimes expand this bleed. The clot is dislodged and the bleed may extend. I have seen a cephalhematoma happening in a month-old baby secondary to these massages as well. Total resolution may take months, but no intervention is needed. In some cases, it can be bilateral, especially when it's associated with difficult delivery. So this is a cute baby with a bilateral cephalhematoma.